Okay, I guess we'll get started. So welcome and thank you for joining us. This is session 6C, evaluation of the impact of peer support in the substance use service at Women's College Hospital. My name is Darren Greer and I am the moderator for this session. So before I introduce the speakers and start the session, just a couple of reminders. The session is being recorded. If you have a question during the session, please enter it into the Q&A box at the bottom of your screen and I'll deliver to the speakers once the presentation is over. You can add comments in the chat, but please make sure that you add any questions you want the speaker to answer in the Q&A box and not in the chat. You're also after the presentation, you can raise your hands with the raise hand button at the bottom of the screen, and I will go through and unmute you on the side, and you can ask your question directly. So now I'll introduce the speakers for the session. Dr. Pamela Leece practices clinically in substance use at Women's College Hospital, The Works, and Kickstart Medical. She also works as a consulting public health physician with the Health Promotion, Chronic Disease, and Injury Prevention Department at Public Health Ontario. She is an assistant professor cross-appointed with the Department of Family and Community Medicine and the Dalai Lama School of Public Health at University of Toronto. In her current role as a WIHV Innovation Fellow at Women's College Hospital, her research focuses on population health and health system research on substance use. Walker Akhlaghi is a peer support worker at Women's College Hospital Substance Use Clinic, where she brings her lived experience to provide compassionate and informed support to others. She is deeply passionate about assisting individuals on their journey through addiction recovery, mental health challenges, accessing affirming medical care, and navigating government and housing systems. Drawing from her personal insights, Walker advocates for the value of non-clinical perspectives in clinical settings, emphasizing their role in fostering understanding and trust between service users and providers. Her work focuses on creating supportive, person-centered care that empowers individuals to achieve their goals. And our third presenter, Susan Dobson, has had a long-standing passion and interest in addressing issues of social justice. Susan brings a unique perspective to her work as a person with lived experience and mental health distress, as well as a person with lived experience as a family member of a psychiatric consumer/survivor. Susan has been working in the social services field in the GTA for more than 20 years. Trained as a peer support worker in 2011, Susan has been the executive director for the Crosman Center for the last 10 years. Crosman Center is a community-based mental health and addictions agency offering a wide range of peer support-based programs. Welcome, Pamela, Walker, and Susan.
I'm just sharing our slides, and I'll do some administrative slides before we turn it over to Susan. So for our disclosures, we received Women's College Hospital Foundation funding and no additional in-kind support, no conflicts of interest identified. We have our employment disclosures listed here with no other commercial disclosures. And I've had other research support from CHR Health Canada and Public Health Agency of Canada. And just in terms of any bias with being involved directly in the peer support program discussed here, it's mitigated by the scientific review and ethics review of this evaluation, and there's no commercial interest involved. And we also use standardized tools in the evaluation and other reflection among the team to mitigate any bias. So just some acknowledgements before we get started of the land that we're presenting from. Our project is based in Toronto, and it's the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and Wendat people, and now home to many diverse First Nations, Inuit, and Métis people, and continuing as team members and for myself to learn the truth and be able to make my own commitments around reconciliation. Also to recognize people who use drugs and their strengths and innovations, including peer support, which we'll talk about today, the rest of our team, and the funder. Our learning objectives for this session are discussing the development of the peer support partnership and the evaluation, and describing more of the detail around the peer support program and how it works at the substance use service. And then we'll talk about the method, beginning to evaluate, including the program administrative data, perspectives from learners, clinicians, and service users. So I'll turn it over to Susan for our first section.
Great, thank you so much, Pam, and welcome and good afternoon, everyone. So yes, as we begin our session, we're interested in understanding your current familiarity with peer support, and we're inviting you to respond to the following polling question. We could get that launched. You seeing the poll?
Not yet. There might be some technical difficulties.
Problem. I can have you think about it. Oh, here we are. Okay, so we are curious to know how many attendees are familiar with peer support as a field of practice. How would you describe your level of familiarity or understanding of peer support for mental health and substance use challenges? So choose one: high level of familiarity and understanding, some familiarity and understanding, a minimal level of familiarity and understanding, and not at all familiar, no understanding. So we invite you to answer that question, and we'll wait a little bit to see. Just good to get a sense of that from our attendees today.
Okay, I think everyone's had a chance to answer
Okay, great.
the results.
Let's see the results. The reveal. Okay. Right. Excellent. Great to know. Great to see. A bit of a mix, but we see most of the folks here have a high level or some familiarity and understanding of peer support. So that's great. And we know that peer support has been growing in many ways here in Ontario and many other places over the last decade, I would say specifically, and especially when it comes to peer support being embedded within and collaborating alongside more traditional and clinical approaches to healthcare for mental health and substance use. So thanks so much, folks. And next slide, please. So Women's College Hospital's commitment to innovation and continuous improvement of service delivery, care, and psychological safety for those attending their substance use services clinic led them down the path to partnering with Craftsman Center in order to bring a peer support program to the clinic, a partnership which began in July 2023. Incorporated in 1998, Craftsman Center is a consumer survivor initiative, meaning that we are organized, created, led, and operated and governed by people with lived experience of mental health and/or substance use issues, as well as family members. Women's College Hospital sought peer support expertise from a consumer survivor initiative, which demonstrates respect and understanding of the importance of maintaining the fidelity of peer support as a unique and specialized practice, which is rooted in a long-standing social movement, the psychiatric consumer survivor movement. Our partnership with WCH is strong, based on mutual respect and mindful integration of our respective areas of expertise. Peer support and clinical supports both have value to offer. Craftsman Center's purpose as a CSI, Consumer Survivor Initiative, is to promote recovery, self-help and mutual aid, and empowerment through peer support-based programs and advocacy. Next slide, please, Pam. So what are the benefits of partnering with CSIs for the implementation of peer support programs? Consumer-led and run organizations specialize in peer support and advocate to center the voice and needs of people with lived experience of mental health and substance use health challenges, and in doing so, advocate for positive systems change. Peer support for mental health and substance use challenges was born out of the consumer survivor movement and consumer survivor organizations, such as Craftsman Centre. We and other CSIs in Ontario have honed our expertise in peer support over decades and are also widely recognized as peer support leaders, having contributed to increasing the capacity of peer support in Ontario and beyond through advocacy, delivery of peer support training and development, and recovery education. Craftsman Centre first partnered to implement peer support in a hospital setting in the GTA, the General Toronto Area, starting in 2014, with embedding peer supporters in the emergency department of North York General Hospital. We bring that longstanding experience and our learnings of implementing peer support programs within a number of other clinical settings since then to our work with WCH. Our experience have taught us that peer supporters and peer support programs implemented within clinical settings are strengthened when partnering with a CSI. Craftsman Centre brings our expertise in the values and practice of peer support. We have a larger staff team of peer supporters that make up our agency. All of our organization's programs are peer support based, offering connection, community of practices, and other learning and training opportunities for all our colleagues, including our colleague Walker in her role at WCH. We are recognized peer support trainers, and we have trained peer support mentors and supervisors who bring our lived experience and peer support expertise to the role of supporting all our staff, including Walker and the partnership with Women's College Hospital as a whole. We believe, based on our experiences, that it's imperative for peer supporters to have mentorship and supervision from those who are also trained peer supporters and have specific training in peer support supervision. Next slide, please. Evaluation results inform us how the implementation and operationalization of peer support within the substance use service clinic is going, and will highlight where we can make improvements. Peer support programs can potentially have multiple benefits and contribute to all 5 aspects of the quintuple aim framework within healthcare. Most importantly, peer support programs are intended to improve and enhance the service user's experience. We will gain an understanding from service users or peers regarding what aspects of the peer support program have been most impactful. Does the peer support program reduce barriers to accessing care? Are there improved feelings of safety? Is there a reduction in stigma and improved access to harm reduction? Does accessing peer support within the substance use service clinic offer a different experience? And if so, how? Peer support can advance health equity as we inspire hope through shared lived experiences and/or through aspects of our unique identities and their intersections. Next slide, please. By including service provider or clinician perspectives of the peer support program in the evaluation process, we will gain an understanding of whether or not best practices in peer support are being maintained and highlight any gaps in knowledge to ensure that clinical service providers and peer supporters can work together effectively to support the needs of service users at the substance use services clinic. Have service provider attitudes changed toward people who use substances since working with peer support programming? Results may highlight if there have been any obstacles or challenges with the implementation and operationalizing of peer support programming within the substance use services clinic. Are there areas of improvement regarding collaboration, communication, and the resolving of any challenges? How can program implementation processes be changed or improved upon? An information session about peer support was offered to the team at the clinic when implementing the peer support program, a sort of peer support practice 101, which we felt was an important step in our partnership to ensure role clarity, for example. Has the peer support program enhanced the substance use services clinic overall? What is the value and benefits of this additional component? Is there an increased opportunity for meeting people where they are at, or for WCH service providers to learn about different perspectives? Is there an enhancement to harm reduction approaches? Does the program contribute to dismantling stigmatizing views, social stigma, and discrimination? Next slide, please. Our process includes an evaluation of how the peer support program is experienced by the peer supporter themselves. This is in relation to the experiences of peer supports, other peer supporters working in other hospital and clinical settings. Are they able to maintain the fidelity of peer support and uphold peer support values of hope and recovery, self-determination, empathetic and equal relationships, dignity, respect, and social inclusion, integrity, authenticity, and trust, health and wellness, lifelong learning, and personal growth? Are clinical service providers reaching out to the peer supporters for purposes of collaboration? Do peer supporters feel comfort discussing challenging situations with someone from the clinical team? Have peer supporters' attitudes toward clinical service providers shifted or changed? Have peer supporters' attitudes towards peers being supported shifted or changed? Do peer supporters recognize the unique value add of the peer support program? Do they have confidence and understanding of their role as peer supporter? Effective implementation is critical to success of peer support programs in clinical settings, such as the Substance Use Services Clinic at Women's College Hospital. Have there been obstacles to that success? Support for peer supporters and peer supporter well-being is also critical. Peer support is a unique practice that requires specialized support, mentorship, and supervision. Next slide, please. In summary, this evaluation process will help us ensure the peer support program's effectiveness. Evaluation results can highlight how the program can be improved. Results can determine if the program is adhering to key principles and values of peer support and is operating as intended. Results can help us determine if we're reaching the intended service users or peers, and if there are barriers to their participation that need to be addressed. The evaluation may support with sources of future funding for peer support programs in substance use services, potentially offering value to other teams and settings interested in implementation of peer support programs. It's important to build our understanding of participant experiences in relation to their access to the peer support program. Is it beneficial? Does it contribute to overall health and well-being, quality of life, building empowerment, self-esteem, reducing self-stigma, enhancing social connection, supporting participants' recovery journey? Perhaps most importantly, does access to a peer supporter at the clinic enhance their experience with the clinic generally? Does it contribute to people feeling seen, to feeling heard, and to feeling supported? Next slide, please. This evaluation will highlight ways we can improve on program implementation, operations, and collaboration. It can support peer supporter well-being, helping us to prevent and reduce stress and burnout, and identify any skills, training, and support needs. Evaluation will support us in maintaining the fidelity of peer support, helping us to avoid peer support drift by highlighting instances of peer support drift. In many ways, peer supporters are an emerging workforce within healthcare with many unique skills that can enrich the team. However, within traditional clinical settings, it's not unusual for peer support to begin to lean towards doing more, perhaps menial work, such as filing, data entry, completing forms that are not directly related to the peer support role. As peer supporters in our field have put it, peer supporters aren't gophers, chauffeurs, or mini case managers. Further, it's not unusual for peer supporters to adopt the language and practices associated with the clinical worldview, such as referring to peers they support as their clients or patients, or by engaging with peers, bringing a focus on their clinical treatment plan rather than having more of an intention to build an authentic peer support relationship centered on and led by the peer being supported themselves. Over time, the work of many peer supporters can begin to resemble the work of other clinicians on a team. This is what we mean by peer drift and what we need to avoid in order to uphold the fidelity of peer support and in turn for peer support to offer its utmost mutual benefits. There is mutuality and reciprocity in peer support, benefits for both the peer being supported and the peer supporters ourselves. Consumer Survivors Initiative face significant challenges related to insufficient recognition of our unique role and value and insufficient funding. Mutually respectful partnerships such as ours with Women's College Hospital and participation in this research help us to address these challenges and to advocate for a continuing role for peer support delivered through and supported by CSIs within the healthcare system. We appreciate this opportunity to contribute to the growing body of research regarding peer support, to enhance evidence-based knowledge in this area with the goal of program and system improvements. Next slide, please. Organizations such as Women's College Hospital are helping create the culture and climate to empower peer supporters and peer-run organizations to thrive as change agents. After all, at our core, as peer supporters, we are change agents. As peer supporters, we're the evidence for recovery, that recovery is real and possible, and our very presence shakes up the theories about the course of mental health and substance use-related issues and diagnoses. By simply showing up at work, we inspire hope in ourselves and those we support. We disrupt the paradigm of hopelessness and chronicity that all too often continues to surround mental health and substance use. We are the evidence that it is possible to live our lives and not just our diagnoses. We will continue to strive to demonstrate excellence in peer support, one connection at a time. On that note, I'm going to hand it over to my colleague, Walker. Thank you.
Thank you so much, Stephen. So just to reintroduce myself, hi everyone, I'm Walker. I go by she, her pronouns. I am the peer support worker at Women's College Hospital in the Substance Use Clinic. So as we move on to the next section, we have some polling questions about your current knowledge of peer support. So please respond true or false to the following 3 questions. Darren, if you wouldn't mind pulling them up. Awesome.
Everybody see them? Okay, I'm going to stop the poll now and share the results.
Awesome. So for the first one, peer supporters can play an important role in ensuring medication and treatment compliance. It looks like most of the results said true. This is actually false. So peer supporters encourage peers to make their own self-determined choices from a strengths-focused recovery philosophy of peer support. And peer supporters engage in mutual relationships with peers instead of adopting more clinical boundaries or approaches. Second one being, peer support is a friendship between people with shared lived experiences, true or false. Most of the results says false. That is correct. Peer supporters do not engage in friendships with those they support. Rather, they build supportive, healing relationships while also maintaining professional boundaries. And the last one, peer support is most beneficial for those with low-level needs, but less helpful for those with severe complex needs. Majority said false, and that is true. Peer support can be beneficial for people at any level of care need. In 2020 in Ontario, the Roadmap to Wellness, a plan to build Ontario's mental health and addiction system, it identified peer support as a proposed core service for people with low to complex service needs. So yeah, thank you so much. If you could move on to the next slide, please. All right, so that brings us to the question, what exactly is peer support? So peer support refers to services provided by and for people who have had similar lived experiences. It is rapidly becoming one of the most valued, accepted, and effective approaches to assist people who experience mental health and addictions challenges. Peer support is unique because it fosters values including self-determination, equality, mutuality, and empathy, as well as recovery and hope. And this approach can take on many forms, such as peer support groups, one-to-one mentoring, crisis services such as warm lines, support in employment and creative activities, etc. Its potential is truly limitless. Next slide, please. All right, so what are some of the principles of peer support? So peer support is a naturally occurring, mutually beneficial process where individuals with shared experiences meet as equals, sharing skills, strengths, and hopes to learn from each other on how to cope, thrive, and flourish. So some core principles of peer support include mutuality and shared experience. Peer support is built on the idea that people who have experienced similar challenges can offer unique and valuable support to one another. Empowerment and self-determination. Peer support aims to empower individuals to take control of their lives and make their own choices, rather than being passive recipients of help or support. And a recovery focus. Peer support is rooted in the principles of recovery, hope, and individual empowerment, recognizing that recovery is possible and that people can live fulfilling lives despite challenges. Next slide, please. Thank you. Some other principles include respect and dignity. Peer support recognizes the inherent dignity and worth of all individuals and treats them with respect, regardless of their background or circumstances. Collaboration and connection. Peer support emphasizes collaboration and connection both within the peer support community and with other service providers. Ethical practice. Peer support workers are expected to adhere to ethical guidelines and standards of conduct and learning from each other. Peer support is a process of co-learning and growing together, where individuals share their experiences and learn from each other's strengths and perspectives. Next slide. Thank you so much. So we're going to be talking about a little bit about the brief history of peer support in Ontario. So in the 1970s and the 1980s, a shift in mental health care emphasized community support. The hope was that those with mental health difficulties could be treated in general hospitals by their own family doctor, and psychiatric institutions could be used for more specialized and complex services. This process, called deinstitutionalization, was based on the belief that individuals' lived experience, also known as consumers, could support one another and create changes in their communities and mental health system. However, the need for adequate community support was underestimated at the time. When deinstitutionalization began, policymakers and service providers did not fully recognize how much support consumers would require to successfully live in the community. Necessary resources such as housing, peer support, and mental health services were not always sufficient. This lack of adequate support made it difficult for many individuals to thrive outside of institutions. Next slide, please. Thank you. So in response to this, groundbreaking reports such as Towards a Shared Direction in Ontario and Building Community Support for People led to funding for the first Consumer Survivor Initiative in 1991. This resulted in the Consumer Survivor Development Initiatives, which was a project designed to tap into the skills and knowledge of those with lived experience in the mental health system and provide them with support and employment opportunities. By the middle of June 1991, funding decisions had been made, supporting 42 programs across Ontario. And since then, the community mental health system has continued to evolve, which in turn has allowed peer support to be steadily viewed as a vital part of Ontario's healthcare framework. Next slide, please. All right, so what is some of the evidence for the effectiveness of peer support? Studies have shown that people who use peer support have similar or better outcomes to people who use traditional services only. People who use many kinds of peer support report a high level of satisfaction and positive changes in their lives. These include reduced substance use, reduced experience of psychosis and depression, reduced use of health services, including hospitals, increased social support networks and functioning, increased ability to cope with distress, increased quality of life, and increased ability to communicate with healthcare professionals. Next slide, please. So, in regards to Women's College Hospital and the Substance Use Clinic and peer support, at our Substance Use Service Clinic, we have RAM, which is the Rapid Access Addiction Medicine Clinic, and we have RAM Hours, which is where peers who need urgent assessment can be seen without a pre-booked appointment. RAM hours are intended for people attending the clinic for the first time and for people who are not connected to care elsewhere. The clinic operates as an in-person and virtual clinic. Typically, I am the first point of contact for peers. I'll introduce myself to them and bring them into a room to speak and briefly explain what the process or flow looks like if it's their first time here. Next slide, please. So I will introduce myself to them. Usually I say something along the lines of, "Hi, I'm Walker, and I'm the peer support worker here." The way this works is that I'm the first point of contact and I briefly assess what brings you in today. After that, an addiction service worker will do your official intake. This is where they're going to ask you some more in-depth questions about your substance use, but don't feel pressured to answer anything you're not comfortable with. After that, you'll see a physician who will come up with a care plan with follow-up afterwards. I will also ask them if they are aware of what a peer supporter is and explain my role and the types of supports I am able to provide. And I do everything I can to make them feel as comfortable as possible. So this means asking them how they're doing and checking in, seeing if they need any food or water, and if there's anything I can do to make this process feel a little bit more smoother and comfortable. Next slide, please. So peers do not actually have to go through the entire RAM intake or follow-up process to connect with me. They can simply state that they are interested in accessing the peer support worker and they can be booked into my schedule, or if I'm available, I'll say hi and then go from there. I'm also able to share my work phone number with peers in which I can provide virtual care over the phone, text, or video. And the support I provide can range widely from providing peers with resources that may benefit their mental health and wellness journey, such as detoxes, housing programs, queer-specific and general healthcare, government assistance, to simply being a listening ear. And to be completely honest, most of my role is talking with peers and hearing about their day-to-day lives, which in my opinion is the best part. Next slide, please. So what are some other successes I had in the substance use clinic? I've created resource brochures. The one being displayed on screen is intended for people coming into the clinic for the first time. These are kept by the front desk and they kind of just give an overview of what kind of services our clinic offers. Overdose Awareness Day. I'm responsible for planning events both here at Women's College Hospital and also community events regarding Overdose Awareness Day. Outreach. I'm responsible for making other organizations aware of our services and sometimes forming a formal partnership with them to streamline connections for peers. An example would be Elizabeth Fry in Toronto. Contingency management. I'm a facilitator for this program for stimulant users. And harm reduction kits and supplies. I create and manage the harm reduction kits in our clinic. Next slide, please. So what do I love about this role and what are some of the challenges? I'll just start by saying there are an infinite number of things I love about this role. The one that I hold the most deeply is the fact that I've been able to get to know so many people who were once strangers that I wouldn't have had the opportunity to connect with if I wasn't working in this role. The fact that I'm able to learn so many people's interests, likes and dislikes, stories, voices, personalities from all walks of life is such a privilege that I'm extremely grateful for. The main challenge I have is maintaining professional boundaries. So due to the fact that the support I provide can be seen as quite casual in some instances, especially given that I am not a clinical worker, it can be difficult at times reminding peers of my limits. However, most peers are very respectful of them. I find that this has been less of a challenge after I created a sheet of my specialties and limits that I give out to every new peer that I support. Next slide, please. So this is kind of an example of what would be going onto that sheet. So some of my specialties would include positive guidance and reinforcement. I offer supportive and encouraging feedback to help peers stay on track with their substance use, mental health, and wellness goals. Motivation. I help peers find personal motivation to pursuing their substance use and mental health goals, providing a safe and encouraging space to foster progress. And some of my limits and boundaries would be stuff along the lines of I am not a registered social worker, therapist, or counselor, clarifying that while I do offer peer support, I am not a licensed professional and do not provide therapy or clinical intervention. And something like no weekend availability. I do not check or answer my work phone on the weekends. I will respond to messages once I am back in the following week, so feel free to keep sending me messages and I'll check them out when I'm back. And then maintaining professional boundaries. Similar to what I mentioned in the poll questions that we did, peer supporters do not engage in friendships with those they support. Rather, they build supportive, healing relationships while also maintaining these professional boundaries. So thank you so much for listening, and I'll hand it over to Dr. Pamela Leece.
Great, thanks so much. So this is our last short section on how our evaluation is designed, and we're proud that we're underway with data collection in one of the 4 areas, and we'll have more to share when it's completed. So I'll just ask for the next poll, our last one, as we go into this section. So do you see potential for implementing peer support within your program or setting? And if you can just take a couple minutes to respond.
Okay, I'm going to end the poll now and share the results.
Thanks, Darren. Okay, that's pretty unanimous among our group here who responded, seeing the potential to implement peer support. Thanks for responding. So we have 4 objectives with the evaluation. We want to describe the scope of the services delivered in the peer support program, and that's using our administrative data from the program. We'll examine the impact of the peer support service on engagement in the clinic and retention and connection to other health and community resources. The third is evaluating the team members' perspectives and the successes and challenges with the program so far. And the last area is actually measuring attitudes and stigma toward people who use substances among medical learners. We'll talk about that a little bit more. So all of the trainees, professionals, and service users in the program are part of our scope. So as part of our data collection, we have the administrative data that I mentioned that pulls from the flow sheets of the encounters with the peer supporter. We will do service user interviews from our qualitative perspective. We have an anonymous survey for the service providers, and also the learners do a pre and post rotation survey of the perspectives around people who use drugs and working with them. We have the evaluation team supporting the design and the implementation, and also service users who are involved in the team and setting up the evaluation as well. So the standardized tools that we're using among the service providers and the learners are actually part of the validated tools from Opening Minds, the provider attitude toward opioid use scale, or PATOS, from the Mental Health Commission of Canada. So we've drawn from these questions to be able to have a developed and standardized tool that we're able to look at provider attitudes. So the learner pre-post rotation survey is kind of these different domains about hope or willpower, blame, language, resources, strength, behavior, trust, lots of different areas that come up among the perspectives of medical professionals working with people who use drugs, and then about the peer support program and being able to work on the team with the peer supporter, the values of peer support, collaboration, confidence, benefits of it, and the experience overall. The program administrative data, we have about 1.5 years of the data that we're looking at. Any of the clients who had gone through encounters with the peer supporter. We have some demographics, their age and gender of people interacting with the peer supporter, and then the encounter. There are several factors, the type of encounter, whether it's initial or follow-up, the format, whether it's virtual or in person, location can be in the community or the clinic, the type of support provided, some of the categories of the support, and the substance that the substance or substances that the people are using. And all of this comes from sort of the flow data and administrative data for our program. So service providers involved on the team, there'll be about 12 completing the anonymous survey. We have similar domains to the learners that are listed here, and then also any sort of challenges, recommendations, and about demonstrating the values of peer support in our program in their experience as other service providers. And the interviews will have a sample of about 20 people who have gone through the peer support interactions, asking how well did you connect, how did the peer support you, what was it like, what can improve, how did you feel, what factors are involved in accessing peer support, and then also the demographics of people who were accessing the peer support program. So we have both the quantitative and qualitative data to analyze, which will be descriptive for the quantitative and also thematic for the service user interviews. And then the current status of these components, we have the data collection in progress for the learner surveys. We have our ethics response under review for the service provider survey. And then for you, it's sort of a higher bar for ethical approval, so that application is under review and we'll respond when we hear back. So we'll be going through the next steps over the next few months for finishing the data collection and then being able to interpret it together as a team and reporting and discussing what the implications are and recommendations from what we found. So just our key resources there, and acknowledging the rest of the team. My email's there if you want to reach out after the session to be able to speak further. So I'll stop sharing the slides. We have time for our discussion. I'll turn it back to you, Darren.
Thank you. Thank you all for your presentation. So there's a Q&A button on the bottom of your screen, and if you have any questions, you can ask them there, and I will read them to the presenters. Alternatively, you can just use the raise hand button right on the bottom of the screen, and I will unmute you. So question, we have about, I'd say about like maybe 10 minutes, a little bit less for questions. I have a question, I can get it started. What is the process for screening for eligibility for peer support workers in the agency?
So eligible qualifications for a peer supporter in the field? Yeah, so it can vary. I can speak for Craftsman Center. For us, of course, first and foremost, it is having that lived experience. We have, especially, I can also note that in most recent years, we've been doing more work specific to folks who use substances. So we found that we really needed to find folks who have that lived experience with substance use specifically. It's really important from a peer-to-peer perspective to share that specific lived experience. It could go a really long way in building that relationship and understanding and connection. Now that said, of course, not everyone with lived experience, does a peer supporter make. So we also look for, of course, peer support training. And as I had mentioned in our presentation, we also provide some of that internally. So a lot of our peer supporters, not a lot, I would maybe say about a quarter of our peer supporters, for example, right now have come through our internal training program called the Peer Recovery Education Program. that really provides months-long training on a range of topics, and of course around peer support practice specifically. And then it also provides a peer support internship process. That's a paid internship over a number of hours to give those folks an opportunity to apply the theory that they've learned and put it into practice in a sort of mentorship environment. So yeah, those are the two key things I would say. And of course, there's soft skills that come along with it as well. And yeah, I hope that answers. Thank you.
Thanks, Susan. We do have a couple of questions up. The first one is specifically for Walker. How would you describe the benefits of being hired, supported through Craftsman rather than Women's College Hospital?
That's a great question. I think there are a lot of benefits. Craftsman Center is a peer support organization, so I feel like I always have a great number of colleagues and also managers at Craftsman who can provide specific answers for any questions I have regarding if the peer support I'm providing is appropriate and effective, sort of navigating where exactly my role can lie in certain situations, especially if it teeters more towards something more clinical and I need some clarification as to what or how I should handle something. So yeah, it's just great to kind of have them on my side and know that I can reach out to them if need be.
Walker. The next question is not directed at any presenter. Specifically, do peers provide services out of hospitals, like accompanying clients to community services, etc.?
I can answer that. I would say yes, at least in my role. A part of my role is that I am allowed to accompany peers to other places or appointments as needed. It hasn't happened just yet, but that option is there. So yeah, I would say it depends on the position and the organization, but I'm personally allowed to.
100%. Just to add to that, definitely peer supporters work outside of those clinical settings. So for the example, for our organization, we have our own couple of drop-in centers that are really low barrier places where folks can come in without an appointment and just engage in that peer support environment. And also we have outreach workers that can go into different settings, whether it be other community agencies or accompanying folks to different appointments should they choose for that comfort. And we also have peer supporters embedded in organizations that aren't hospitals. So yes, we're can be lots of places, and just to support Walker's point, it really depends on the particular partnership and the role and the different policies that may apply. Thanks.
Okay, the next question is also to Walker. What brings you the most joy in your work as a peer support professional?
I love this question. I think that obviously if I'm supporting an individual, usually they are going through something quite vulnerable or emotionally challenging. The thing that brings me the most joy in what I consider a successful workday is that if I make one peer like smile or laugh or just I'm like distracted from the stress of life, that brings me the most joy because oftentimes when I connect with peers initially, obviously we all have sort of like a protective layer and this front of, protectiveness. And to see it slowly crack away and see more of themselves come out, and I don't know, it's just having a beautiful relationship forming and just getting to know these people. It's everything about it is pretty awesome.
Thank you. Also for Walker, before creating the sheet about your boundaries and your limits and your role that you give out to clients, did you find that you were violating your established boundaries prior to doing that? And if so, was this impacting you negatively?
That is also a great question. Um, well, I would say created the sheet out of kind of coming across peers who weren't so aware of these boundaries. So I figured it would be good to kind of have initially, especially given that I first meet them, it's important to kind of lay down the lines of what I can and can't do. So I wouldn't say I personally, what's it called, violated my established boundaries. It's more so I don't think I made it clear enough in the beginning when I first started working here. But now that I give out this sheet, everyone respects it. And if they have any questions about what I've put on there, it's definitely like open to a good open conversation. So yeah.
Thank you. And we have a final question, which is directed at all the presenters. What suggestions do you have for frontline staff that you see not necessarily supporting the clients in the most therapeutic way? Have you encountered this?
If I may answer this question, that's a great question. I feel like it's quite important for people, whether in a clinical or non-clinical role, to be treating whoever they're speaking to or providing care to or support to with like treating them like a human, and also asking for their consent and permission when it comes to discussing any sort of vulnerable topics. And sort of like checking in along the way, showing that you're there for them, showing that you do care. And if there's creating a space where like if they do at any point feel uncomfortable, they are able to express that. Um, but yeah, just adding a human touch to interactions is what I would say.
Okay, thank you. That's all the questions that are posted. There is a link to a feedback survey in the chat. I just put it in, so if you'd like to click on that and fill out the survey, it's very short. I just want to thank our presenters, Susan, Pamela, and Walker. That was a great presentation, and I learned a lot from it. I'm sure others did as well. And I'll just leave the room open for a minute or two so that everyone can get a chance to copy the or click on the survey, and then we'll have a 15-minute break, and then at 2:45 we have the keynote speaker who is Dr. Esther Tailfeathers, and that begins at 2:45 p.m. So we have about 15-minute break between then and our keynote. So thank you, everybody.
Thank you.
Just leave it open for another minute or two. Okay, I'm going to close the webinar. So thank you, everybody. And hopefully we'll see you at 2:45 to hear Dr. Tailfeathers. Thank you.